Well, we could all use a little help feeling better about things these days. How about a science-backed therapy that's known to give people measurable results in a short period of time?
And what if we told you one of the best centers for this type of therapy in the world is right here in Connecticut? We're talking about cognitive behavioral therapy, or CBT.
I visited Dr. Tolin, who you may know from TV shows like Hoarders, to find out about how CBT actually helps with everyday anxiety so that many adults and kids can get help for what they're experiencing now.
CBT is cognitive behavioral therapy. That's a form of psychological therapy that is designed to help people overcome specific problems within a fixed amount of time.
It's not your parents' couch time therapy.
A generation ago, if you went to psychological therapy, that meant that you would probably be lying on a couch for years and years and years talking about your childhood. And I'm not saying that that's a bad thing to do, but CBT was developed in response to that, with the recognition that we might get more traction by working on the here and now.
You may be seeing CBT show up in your Facebook feed, touted as a solution for everything from everyday anxiety to more serious mental health issues. Basically, it's a way to reprogram the old negative scripts in your brain that keep playing out.
Once strong emotions take hold of us, we start acting on instinct, and we start acting in old automatic patterns, and we don't necessarily think very clearly about exactly what we're doing and why. And sometimes it takes an outsider's perspective to point those things out to you.
So let's use a real-life example.
Yeah.
The bills are piling up and you're terrified about money.
The bills are piling up and you're terrified about money. So the first thing that we might do is behaviorally work on a plan for how you're going to tackle this. If the person is really not doing well and they're starting to avoid looking at those bills, the therapist might encourage them to make a plan for how they're going to actually look at these bills and deal with them. And if you're finding that your anxious thoughts are getting in the way and they're making you feel completely freaked out, the therapist might challenge you on some of those negative thoughts to say, maybe it's not quite as bad as you're making it out to be. Maybe if we take a more logical approach to it, you'll see things as they are, not just as you fear they are.
Fear and overwhelm are big problems for so many in the pandemic right now. And Dr. Tolin says CBT is a great option for kids with attention issues struggling in this new world of remote learning. How is it helping kids with ADHD right now?
So cognitive behavior therapy for ADHD largely involves teaching the person better organizational strategies. So people with ADHD can be all over the place, and it's hard for them to organize their materials. It's hard for them to organize their thinking, their to-do list. And so a cognitive behavioral therapist might help the person with ADHD formulate a good plan for how they're going to organize themselves moving forward.
What I keep reading is that it should be the first line of defense. Instead of medication first, try cognitive behavioral therapy, and you might not need the medication.
A lot of us believe that CBT ought to be the first thing to try before jumping into a medication. It varies person by person, and I don't want to make any sweeping, generalizations about it, but for a lot of people, therapy can help without medications.
And for all of us wanting real relief now, CBT is known to help quickly.
Cognitive behavioral therapy tends to be a time-limited form of therapy, so you do it for a while, not for the rest of your life. And you and the therapist are working out specific things for you to do that are designed to help make the problem get better.
What's the average course of treatment?
So the average course of treatment for CBT varies depending on the person and the problem that they're getting treated for. But I would say that if you don't start seeing some results within, say, 10 to 15 visits, it's a sign that things need to be changed up. So it doesn't necessarily mean you're cured in that amount of time, but it means you should be able to see some improvement at that point.
Cognitive behavioral therapy is something that you can have access to right at the Institute of Living in Hartford. It's actually a premier center. Dr. Tolin is the head of it, but there's great therapists there. You can go online and find out. Some of them are taking new patients, so people are really struggling right now. This might be something you can do to take an action to help yourself.
All right, coming up next.